So I think the first and foremost New Year's resolution would be weight. Many of you know weight control is a bigger challenge than most of you can imagine. Most resolutions start with that, and I'd like to start talking about that. Hello, my name is Dr. Prakash Chougule. I'm not by any means an expert in weight management. I'm a cancer doctor. But over the years, one thing I've learned is that obesity, being overweight, takes a tremendous toll on the diagnosis as well as the management of not only cancer, but many other medical conditions such as diabetes, blood pressure, heart disease. So, and it's becoming a pandemic of sorts. We talk about epidemic and pandemic in the context of diseases such as COVID and influenza and what have you, but it's a pandemic of sorts. In America now, a good 30% of Americans are overweight or obese, and the worst part is children in the ages of 10 and 18, what we call adolescent. A good 30% of them are overweight, and they're getting adult onset diabetes. So let's start with that, and that's a fact. 90% of people who take the pledge to change things on New Year's have failed. By the time February comes, they've dropped out. So what is my take on it? Well, I came to this country several years ago, and one thing that happened when I left India, so many of my friends and colleagues who had been here before told me, you just wait until you come to America and just step into that fast food chain. I don't want to name any particular chain, but you get hooked to the pizzas and the French fries and the donuts, and you'll gain some 20 pounds within 2 years. Well, what I did right at the airport in Bombay, Mumbai as it is called, I weighed myself twice. Once, I think in April before I left, when I got my visa, and the second one in July when I left India. And to my surprise, my weight had been pretty steady since I graduated out of high school and went to college. So in that intervening 7-8 years, my weight had not changed. I was a very active person. I still am. I'm very athletic. I play a lot of sports, and I'm not a gym person. My activity is to do with my being active. And I have to say, many years later, I still weigh the same. And again, keeping the same weight, does that define being healthy? Maybe, maybe not. But defining as staying fit, I think so. And but does that mean I'm absolutely in a perfect shape I need to be in? No, there is room for improvement, because what does weight actually constitute? There is 4 components, right? Water, bone, muscle, and fat. And water makes up a good 50% of our weight. So that is the backdrop of what I'll be discussing as far as the weight is concerned. And being underweight is a whole different category that I've done some research, but I need to read more about it. But being overweight and obese is actually a ticking time bomb for chronic conditions, and we'll talk about that in the next episode. So for now, enjoy the holidays, and like they say, you want to splurge during the week of Christmas. Well, I have a little reservation about splurging too. When a platter of food comes in front of you, you don't have to eat every single item on the plate. When I go to India, you eat your dinner, and then platter of desserts come. There is that gulab jamun, and there is a burfis, and there is a ras malai, and I can go on and on. Nobody said that you have to eat every one of them. Just pick up one. And I just happen to have, I don't have a sweet tooth, shockingly. But if I had to pick up one, I'll pick up one and gulp it. But just between now, today's 23rd of December and January 1st, you have 1 week. Weigh yourself today and weigh yourself again on January 1st and see what damage have you caused to yourself. Anyway, I know you're looking at me, I'm smiling, but it's a reality, ladies and gentlemen. So enjoy the holidays, and I'll see you next year, okay? Thank you, and have a great year.